Hi, good morning, everyone. Sorry to be a minute late getting started here. We've had a couple of technical difficulties, but very happy to see everybody and and appreciative of everyone bringing the sort of levity and humility to online meetings that we are all sort of growing accustomed to. Um, I am Kelly Bourne, Executive Director of the Cyber Policy Center here at Stanford University, and am happy today to be joined by several colleagues. Jacob Shapiro, who is Professor of Politics and International Affairs at Princeton University, where he leads the Project on Empirical Studies of Conflict. Professor Kathleen Carley from Carnegie Mellon University, where she directs two centers, the Center for Informed Democracy and Social Cybersecurity, and the Center for Computational Analysis of Social and Organizational Systems. And finally, from Professor David Broniakowski from George Washington University's School of Engineering and Applied Sciences. And for those of you who are not familiar with the Cyber Policy Center at Stanford, by way of background, our research and teaching focuses on the governance of digital technology at the intersection of security, geopolitics, and democracy. We are home to about a half dozen programs, and our work is really intended to help inform the policy agenda for governments, for corporations, civil society, and academia globally when it comes to questions of the governance of digital technologies. And the webinar today is really an extension of a seminar series that we had been doing in person on campus before all of the recent events emerged, and we have decided to transfer it online. So we will be having these every other Wednesday at 10 a.m. PST, and we'll always be featuring thought leaders from universities across the country who are looking at questions that apply to the governance of digital technologies. In our early days, we're going to have always a through line in these conversations around the coronavirus, both because it is so deeply affecting all of our lives right now, and so much new research is coming out about it, but also because I think it is helping to expose the different vulnerabilities and challenges in our digital systems that really have implications longer term. And so while all of these will have a through line about the coronavirus, we will also be really always keeping our eye on the longer game and even the medium term game of what these vulnerabilities that we're observing mean for the 2020 elections and longer term policy questions. And I think this focus on corona is also really important. We've seen, and today's in particular around disinformation, we have seen the WHO warning of the current infodemic related to this topic. We know that health crises have always been a hook for disinformation campaigns going back to Russia and AIDS. And even as recently as last week, we're starting to observe how disinformation around the coronavirus is spilling over into other aspects of our information ecosystems, fueling the anti-vax movements. For example, last week we saw that Instagram accounts saw views spike from 200,000 in February to more than 2 million in March, and a sort of surge in anti-vax Facebook followers. And I think we're seeing also challenges beyond just the information environment, increased state surveillance related to the coronavirus in Israel, South Korea, China, Taiwan, Iran, and elsewhere that might have longer term implications beyond just health. We're seeing manipulative online pricing as more and more buying activities move online, and just many other ways in which the current situation is affecting our digital systems. So the series, as I said, will touch on the current moment, but really with this long-term view of what the policy implications are in mind. We will always be doing these webinars in collaboration with colleagues at other universities. Next week, we will have some colleagues here at Stanford and also at Harvard looking at journalism in the digital age. And then just a few quick operational notes. We are recording the webinar so that we can post it on our site. Everyone is muted. And we will ask for folks to engage in sort of questions in the chat, and really appreciate that for, I think, all of us who are socially isolated, and for myself only mostly getting questions from my 4-year-old at this point. I would really appreciate questions from others that might be of a more sophisticated nature. So please put those in the comment section, and I will do my best to sort of moderate those as we go. We'll start with comments from Professor Shapiro, who will speak to trends and themes in corona disinformation narratives and news reporting on the topic. We'll then go to Professor Carley, who will talk about how information is flowing between countries, the role that bots are playing, and differences in who broadcasts certain types of disinformation. And then we'll go to Professor Broniatowski, who will speak to the sort of broader world of health disinformation, looking at what he has seen around vaccines and the role of bots and trolls in those debates, what makes messages go viral, and a conversation then about what the implications might be for corona. And then we'll try and save 20 minutes for Q&A as well. So with that, I will stop there and ask if Jake, you're able to share your screen with us.
Yes, absolutely, Kelly. Thank you for the introduction there. So what I want to try and do with our time together today is basically briefly walk through this outline. So I want to provide a little bit of background on the work we've been doing on the ESOC team at Princeton, and then talk about the relevant social science, which kind of, I think, breaks down into two categories. Number one, you should be really worried that misinformation is going to screw up the public health response. And number two, it's probably going to be okay. So I'll talk about things that fall into both, and then I'll talk about a little bit of what we're seeing in terms of narratives. So that's the agenda. In terms of what we've been doing, starting on March 6th, we assembled a team of research assistants whose names are listed here because they're doing awesome work in 14 different languages to start to pull down basically the narrative themes that were out there in COVID-related misinformation. As of 5 p.m. last night, there were 263 different stories that we tracked. Many of these are promoted in lots of different places. And for each of these stories, we're cataloging them in a few ways in terms of what story is the disinformation pushing, the narrative type. I'll talk a little bit about those in a few minutes. What do we infer to be the motive behind the disinformation, given the context around it, and who is responsible? And for each of these, we're putting up on our website a daily dump of what we found in the last day, any updates to the coding criteria, and things like that, as well as the original URLs where the disinformation is reported to have been, and the news source that's reporting on it. And the goal of this is really to provide like some ready background for people who want to then go on to build machine learning algorithms, classifiers, or other things. It's, just trying to take advantage of like the excess energy that the students have to do something on this to contribute to our understanding. The other thing we've been doing is just trying to pull together a listing of all the resources that are available. So on that spreadsheet that we're putting up periodically, we're also, we have a sheet that just shows all the resources that are out there for work on this topic. And the crowdsourced resources that are up there are really spectacular at this point. We're not the only ones doing this, others are doing this. This is a screenshot of the GitHub page that Nathan Matthias and Alex Levitt, Alex is at Facebook, have put together, just listing all the social science projects that are ongoing. So if you're thinking about doing a piece of research, you can quickly go there and see what else is going on. And they have several hundred projects on there already. So that's the kind of background on what we're doing. Let me turn to relevant social science. And I want to start with reasons to be worried. So the first reason to be worried is that there's a lot of evidence over the last decade that people are increasingly reliant on health information coming off the internet. So one recent Pew survey found that for 80% of Americans, it was a major source of where they went for health information. So the potential for the internet as a distribution channel for misinformation is dramatic. There's pretty good evidence from the Ebola pandemic in Africa from 2014 to 16 that misinformation, not necessarily online in that case, but that misinformation can screw up the public health response. So regions in Sierra Leone and Liberia, where there was more information spread, saw higher mortality rates from the pandemic. And in the United States, with respect to annual mortality for children from flu, there's both good evidence that not getting your kids vaccinated is associated with exposure to anti-vax misinformation, and that deaths from flu are predominantly in the children who've not been vaccinated in a given year. Now, the causality there is not strong, but it's enough to make one worry. The third reason to worry is that so far at least, the platforms are not doing a great job apparently of removing the content. Now, where great sits is really hard to judge, but there's a lovely study out last night by the Oxford Internet Institute where they sampled 225 pieces of social media content that had been rated as false by a fact-checking network. And they just went out and looked how many of those could they still find on platforms. They found 59% of them were still up on Twitter, 27% on YouTube, and 24% on Facebook. So there's definitely like removal, but it's not comprehensive yet. And then the last reason to be worried is there's some evidence that susceptibility of behavior to bad information is non-trivial. So my colleague Austin Wright at University of Chicago has been exploring this with county level data, and he told me it was okay to share this with this audience, so I wanted to do this. This is quite preliminary. But what Austin has done is he asked a very simple question, which is, how do movement decreases around the timing of a local ordinance for stay at home or shelter in place or whatnot, how does that differ as you think about exposure to different media platforms? And what this side shows you is in county level markets where there is a Sinclair Corporation Fox News outlet, the ordinances are not associated with reduction in movements. These are in standard deviation units using average distance traveled, but they are clearly so associated in places where there's no Sinclair station. And so we should be worried that where people are exposed to media, which is systematically discounting the severity of the pandemic, there is less of a response to the public health admonitions from officials. So that should make us quite nervous. Okay, so why should we think it's probably okay? Well, the first is there's evidence from my colleague Marcus Pryor and others, which suggests that partisan evaluations of economic conditions can be killed with very small monetary incentives. And so if you think about the strength of the incentive of seeing hundreds or thousands of people in your state dying from this disease, there's good reason to think that motivated reasoning will go down as the severity of the pandemic goes on and as it continues. The second is that one of the positive pieces of evidence from the Ebola epidemic, and this is due to Bilal Siddiqui and Andrila Dubey at University of Chicago and their co-authors, is that community health interventions which increase trust in health workers substantially reduced the mortality rate from the Ebola epidemic, even as they increased reporting. So it's definitely possible to do things in terms of how public health officials interact with the population, even in the worst circumstances, that improve the response. And the best evidence that we have from several recent studies is that fake news exposure is actually quite low in the population. So my colleague Andy Guess and others looked at fake news or kind of dubious news website exposure in the 2016 election, and they found it was less than 6% of Americans' media diet. Recently, David Lazare and colleagues have a paper where they look at exposure to fake news on Twitter, and while it was again approximately 6% of the news content that people got through Twitter, that was highly concentrated in the 1% of the population which saw 80% of the fake news content, and the 0.1% of the population that shared 80% of it. So it doesn't seem to be like a terribly widespread thing. So social science gives you reasons to be worried and reasons to be positive. Okay, so what about the trends in disinformation narratives? So what this plot shows you is it's just the count of articles where the news media in the different countries we're tracking have identified fake news stories and kind of publicized them. And the way to think about this is the number of narratives on a given day, not the number of stories, right? So it's not a measure of total volume. It's kind of like the diversity of the narratives that are being captured by the media. And you can see a steady upward trend, especially after early March, when the scale of the problem becomes really clear in the US and EU. What do those narratives look like? They're spread widely. The largest one is misinformation about the nature of the emergency response, followed by false cures. And then there's this group of different kinds of narratives that you see around the nature of the virus. So one's about either its transmissibility, that it's a designed organism, or where it came from, trying to attribute it to particular ethnicities or countries in ways that are scientifically dubious. And then there are these kind of residual categories that are out there. Turning to the motive, the majority of the different narratives that we're seeing out there fall into this kind of catch-all category for us, which is other, which is basically you're trolling for entertainment purposes, and things that don't fall easily into profit politics, undermining institutions, or fear. We're not seeing in the narratives that we're looking at yet a lot of diversity in the narratives around profit-seeking behavior. That's just kind of an interesting observation about the distribution of narratives. If you want to think about like what falls into these different ones, this is just a kind of nice listing of typical headlines that fall into each. And I want to highlight the first two because there's an interesting pattern there, which will be relevant on the next slide, which is that the political content around COVID seems to fall into these two categories. One is trying to promote particular individuals or political actors or denigrate particular ones. The other is going after the institutions in particular target countries. And the border between these is it's a little subjective. We have some nice coding rules that seem to be pretty consistent. Both of those kinds of activity are much more likely to come from state actors than other kinds. So when we break down the distribution of actor types, this is basically what we see, which is that the vast majority of the narratives, as far as we can tell from the reporting, are coming from individual actors, not from companies, politicians, or states targeting other countries. And that's important. Now, that state sponsor category, that is almost entirely narratives that are trying to shape the future politics around the pandemic. So they're not going after screwing up the emergency response. The state actors don't seem to be yet going after promoting fake information about how to deal with the virus. What they seem to be doing is promoting stories about the responsibility for the virus, which can then later be used in geopolitical disputes in the way Operation Infection was with HIV/AIDS. Okay, so some preliminary conclusions. A large share of the narratives seem to be being promoted on chain messages and through different kinds of emails and not on the media. There's a very clear and strong media response towards this in March. Some of that, I think, reflects the fact that it didn't really hit open societies in a big way until March. And again, that we're not seeing a ton of organized actors promoting misinformation content as measured in terms of the diversity of narratives. I think Kathleen's going to give us some evidence that their organized actors are quite important in terms of the total volume of activity. But in terms of the diversity of narratives, that's what we're seeing. And I'll stop there and hand it off to my colleagues.
Great, thanks so much, Jacob. And Kathleen, are you now able to share your screen with us?
Everybody for joining us, and thank you, Jake. So this is some work that our group has been doing. We've actually been collecting data on the coronavirus since back in January from multiple languages. It is well expressed that across all of social media, the amount of information that we see on coronavirus has exploded. And it's exploded in every country, and it takes a wide number of different forms. It includes things such as satire, such as you can drink beer to avoid getting coronavirus or drink beer to get it, to jokes, self-help, fact-checking, and so on. It's just a huge amount of information, and we're finding that it occurs in every country. With over 65 million tweets that we have now, almost close to 100 million actually, we have found that they are spread throughout every country in the world, with the vast majority of them, of course, coming from the U.S., from the South and North America, and China and India. Nevertheless, the amount that has been growing throughout the world has increased, and the number that are being spread throughout Africa and so on is important and has grown dramatically just in the last 2 weeks. Although this is Twitter data that I'm showing you, similar kinds of things are actually occurring for other platforms and other media that we have looked at, including YouTube and so on. We're looking at different kinds of disinformation, and what we have found is that the disinformation tends to fall into multiple different categories. 6 categories in particular have stood out.
I'm sorry to interrupt real quickly. We weren't sure if you had actually wanted to share slides or if you, because we can't see any if that was your intent.
You're not seeing the slides?
Oh, now we are. Thanks so much.
Okay, so we're actually seeing, disinformation occurring in every country around the world, and we're seeing lots of different kinds of disinformation occurring. The stories that we've seen so far, and we're actually working now to expand this number out, the vast majority of the disinformation stories out there are about cures and preventative measures. This is quickly being eclipsed by stories about emergency responses, which is growing rapidly. There's also a lot of stories about the weaponization or the bioengineering of the actual virus itself. These kind of stories and how they're spread, they range from the absolutely humorous to the absolutely lethal, such as drink bleach. They range from absolutely crazy, such as China is shooting everyone who has COVID-19, to feel-good stories, such as the reduction in pollution around the world, particularly in Italy, has led to the canals being clean, and the swans and dolphins have returned to the Venetian canals. So there are all kinds of different kinds of disinformation out there, and they're spreading. What we're finding happening with these is that a lot of this information is being spread, is coming from what we call black news sites. We've looked at the various news sites out there, and the black ones are ones without a credible review process and that are known for spreading just huge amounts of mostly disinformation, whereas a green news site is one that has a credible review process and does everything possible, rarely spreads disinformation. So BBC would be an example of a green news site. What we're finding is that a lot of the information that is disinformation is citing and going back to one of these actual black news sites. What we're also finding is that a lot of times this information is being spread within country. So your friends and neighbors are more likely to spread information that you put out than they are to spread information coming from China or someplace else. We also find that users are much more likely to rebroadcast disinformation than they are to rebroadcast true information. The irony here is that the majority of information out there on COVID-19 on the news channel, on all the social media channels, is actually accurate. Okay, but that is typically not rebroadcast or retweeted. It's more likely you're going to get a retweet of the ones that are disinformation. In terms of who is spreading it, the vast majority is being spread by regular users. A regular user might be an individual or it might be a bot. Second most likely is by a news agency or a news reporter. What we find is that even though news agencies and news reporters are very unlikely to spread the information, when they do, they tend to be among the most rebroadcast of all the media and the most likely to have their stuff put out on, move between channels, like between Twitter and YouTube or Twitter and Facebook. One of the reasons the news agencies are so high at spreading the dark information is that some of those news agencies themselves do not have credible review processes. From a country-to-country perspective, what we find is that in terms of accurate information, many countries around the world are actually consuming accurate information that is first posted in the United States. So, for example, Hong Kong is very likely to adopt accurate information from the U.S. For inaccurate information, many countries produce it, and who is producing it has been changing. But early on, a lot of the misinformation was in a collaborated coordination campaign coming out of Mexico and another one out of China, and the largest consumer of that disinformation was the United States. In terms of the disinformation, we took the different kinds of disinformation campaigns and put them into, or working to build these machine learning algorithms to categorize these automatically. A few of them are very, very easy to spot, such as those dealing with the weaponization of coronavirus. This would be things like the CIA created the bioweapon, the drink bleach one, the drink chlorine one to cure yourself, and the use garlic or sesame as a preventative measures. What we find is that for conspiracy theory ones, like weaponizations, they tend to move within a country. So your friends and neighbors are more likely to retweet your messages if you send out something about a conspiracy theory than they are if you send out something about garlic or sesame. They also will be more likely to retweet things about lethal cures and satires. So a lot of the spread of disinformation that is lethal or anti-state are actually being spread within countries. In contrast, prevention and cures are being spread from country to country and throughout the world very rapidly, much more so than just normal media, normal posts. In terms of who is being influential in this, we're finding that it's bots. Of the top 50 influential mentioners, 42% are bot, 82% of the retweeters. On average, on any day in the coronavirus data that we have, what you're seeing is around 45 to 50% bots. So they're huge and they do not fluctuate. The thing about those particular bots, though, is what they're doing is they're actually focused on certain opinion leaders, certain state-sponsored accounts, and a lot of their stuff is rebroadcasting that information from those accounts. For example, if we look at some of the top sponsored accounts, these are state-sponsored accounts, so they're owned by those countries, and look at who is rebroadcasting their messages. Of the 50 users who promote these state-sponsored accounts, 94% of them are bots, and that is that's strongest in the case of China and Russia. So if you look at state-sponsored accounts talking about what to do with COVID-19 coming out of the governments of China and Russia, there's this army of bots that are respreading that, and they're respreading it, linking it into YouTube, linking it into Instagram, and they're utilizing memes and videos as a way of furthering their messaging. If we go on to look at hate community and hate speech in this area, what we find is that the amount of hate speech is fairly low, the amount of abusive language is fairly low in people talking about COVID-19. But of those individuals who are talking about this, what has been happening is that there has been a growing community. There's been growing of hate communities. In the images you're seeing, the red dots represent the people using hate speech. The yellow are those using abusive language, and the blue are just everyday users. What we find is that the bots are predominating in the everyday users. The bots are not spreading abusive language and hate speech, but the hate speech communities are becoming more cohesive, more talking to each other, and more focused. And the kinds of things that they're talking about are the Diamond Princess, they're talking about the government, okay, and so on. So they're focused around specific objectives that they feel are hurting themselves. Overall, social media, we find, is in some sense overwhelmed with disinformation. But to say overwhelmed, what we're saying is that's the popular information. On any day, you will find that about 70% of the information is actually not disinformation that is related to the whole coronavirus outbreak and so on. Of the disinformation that is being spread, about 35% of it has to do with these conspiracy theories, and another 20% or so of it has to do with fake cures and fake preventions. Some of this is coming from black news sites. Hate speech tends to be growing into hate communities, which is very disheartening. And the bots are being used not to start these things, but they're being used strategically, often in whole armies of them together, to amplify some of this information and to help it move between sites, particularly linking to YouTube and to Instagram. Okay. Thank you.
Thanks so much, Kathleen. And David, are you able now to share with us?
Absolutely. So I want to start out just thanking the previous two speakers for some fantastic talks. I think it really does sort of set the stage for what I'm going to talk about here. The main question that I would like to bring up is, what can we do about these online adversarial campaigns? And what are some of the other environments to which we can compare them? I've done a lot of my work in the anti-vax community over the past 5 or so years by an R01 that was supported by the National Institute of General Medical Sciences. And so what I'm going to talk about here is some of the findings from that R01 with several new insights from COVID-19. The caveat, of course, being that the COVID-19 insights have not yet been published, and so should therefore be taken accordingly. So simply to start out, what's our setting here? Well, so both of the previous speakers mentioned Russian troll campaigns. And in fact, we have quite a bit of evidence that Russian trolls were quite active in amplifying the anti-vaccine discourse in the 2016 elections, in particular around issues pertaining to politics, around issues pertaining to Black Lives Matter, and in trying to create false personas associated with specific supporters for political candidates. And our key findings from this study were that Russian trolls were about 22 times more likely than the average Twitter user to tweet about vaccines. It was one of their topics that they were primarily focused on. But when we started looking at sophisticated social bots, they were also significantly more likely. I want to say something like 12 times as likely. Interestingly, the Russian trolls played both sides, whereas the bots tended to be predominantly anti-vaccine. But if you go and you look and do a deep dive into the content that the Russian trolls are sharing, they were primarily about promoting discord. So even their pro-vaccine content was designed to make people angry, essentially calling anti-vaxxers stupid and trolling anti-vaxxers. Was one of the things that we saw a lot in the pro-vaccine Russian troll discourse. What I'm going to show you here and talking about very briefly are some novel findings that are currently under review with my colleague Aylin Chalishkan at GW. Here we used a method to extract biases from corpora that had been published in 2017, and we gathered a data set of anti-Chinese hashtags on Twitter for about a week. Surprisingly, what we found was that there was significant pro-Russian sentiment in this data set of Chinese hashtags that was not expected. China was, as expected, associated with unpleasantness and panic, whereas Russia was associated with calm and pleasantness. The US was also associated with panic. Of course, that leads us to ask, well, what's actually kind of going on in China? And we recently published a study that tries to sort of contextualize a lot of what we're seeing now. Some of you may be aware that in July 2018, there was something of a scandal in which one of China's largest biotechnology companies was found to have actually manufactured a set of ineffective rabies vaccines. This story went absolutely viral on Weibo, which is the Chinese, calling it the Chinese Twitter isn't accurate because it's larger than Twitter, but it has a very similar structure to Twitter. And our findings, in short, suggest that public trust in government health directives had already been eroding prior to the COVID-19 outbreak. In particular, if we look at the week before the scandal occurred, what we see is very low levels of doubt in government. 2 weeks later, they are through the roof. If we look at how people talk about vaccines before the scandal, people primarily report getting vaccines in a positive light, whereas 2 weeks afterwards, that has gone down significantly. And if we look 1 year later, about 6 months before the COVID-19 outbreak, what we see is that people now are once again self-reporting vaccination, but doing so in a way that says, I'm concerned, how can I trust that these vaccines aren't hurting me, whereas prior to the outbreak, people are proud of their kids for not crying. So what we're seeing here is that the Chinese, this was almost a perfect storm where the Chinese level of trust had already taken a very large hit prior to this outbreak occurring. We also have some quick analyses here of work going on in Iran, where my student Pidram Hosseini, who's a native Farsi speaker, has been analyzing Persian tweets. And one of the things that he found there was that there was quite a very large proportion of satire in Persian tweets. And unlike in some other contexts, there are conspiracy theories that are being used to actually promote pro-social behavior in Iran. Whereas what we typically see in Western contexts are conspiracy theories are playing down the threat of the virus or trying to blame it on some other actor. In Iran, there are theories such as the US created COVID-19 as a bioweapon, therefore stay home to save lives. Right? And so that linkage is something that's relatively, we think relatively unique to Iran, but this technique seems to be ineffective because what we have started to observe is that the conversation volume in Iran about COVID-19 is going down, whereas the number of cases continues to grow exponentially. And so there may be some cultural factors there. Moving back to the US, obviously not everything about vaccines is a foreign information operation. And in fact, there's quite a bit of concentration regarding the actors that are responsible for spreading anti-vaccine ads on Facebook. We've seen that two actors, World Mercury Project, controlled by a politician, and Stop Mandatory Vaccination, controlled by a California businessman, were responsible for more than half of all of the anti-vaccine ads in the Facebook ad archive at the time that we did our study. Whereas if you look at the pro-vaccine ads by comparison, the number was quite more widely distributed. There were about the same number of pro and anti-vaccine ads, but many, many more pro-vaccine ad buyers. So there are certainly true believers out there, but they're quite concentrated, which leads us to talk about organized anti-vaccination campaigns, which is something that we've already seen going back to the Zika outbreak, and in fact, quite before, where people are trying to link existing ongoing world events into narratives that had previously existed. So for example, the claim that a larvicide was responsible for Zika's birth defects rather than the virus itself. So one of the things that we wanted to look into here was the extent to which this may or may not be true in COVID-19. And in fact, we see similar sorts of things going on in COVID-19, where we actually identified the 2,000 most active vaccine-related Twitter accounts in January, and we looked at what sorts of things they were sharing about COVID-19. Long story short, the anti-vaccine accounts tended to share more of the conspiracy theories related to the disease's origin, rumors about authoritarian Chinese containment strategies, and comparisons to other disease outbreaks. A particular subset of these anti-vaccine accounts were much more likely in sharing the bioweapon conspiracy theory. But pro-vaccine accounts also shared false facts. In particular, the notion that you should really not worry about COVID-19 and get a flu shot, which is something that this meme here, Kermit the Frog meme, seems to be amplifying. So the intention here is to communicate that just because you are pro-vaccine doesn't necessarily mean that you're immune to being factually inaccurate. And the ways in which people share misinformation seems more associated with contextualization and this notion of facts out of place. And so that's some work that we are hoping to have submitted shortly. Broadly speaking, the notion of the effect of narratives on health behaviors has been around for quite a while. In 2012, the journal Vaccine put out an entire special issue devoted to this topic, specifically focused on the role of narratives in making this information compelling and using anti-vaccine tropes as an example. And so we actually wanted to understand at the time what it was about these narratives that might make them compelling to maybe give us some insight in how to combat them. And we were driven by fuzzy trace theory, which is a theory of decision under risk that posits that people encode bottom line meaning, or they essentially contextualize the narratives rather than simply looking at their factual accuracy. And in particular, for online narratives, gists communicate a coherent story about causality and satisfy a meaning threat. When people see strange or unexplained outcomes, they try to figure out why those occur, and people who are prone to trying to connect the dots will tend to fall more into conspiracy theory camps. So according to fuzzy trace theory, messages that produce these more causally coherent gists will be more influential. Whereas in fact, what we see now is an environment in which several medical health communicators still emphasize just communicate the facts, which does not contextualize. So we tested this in the context of the Disneyland measles outbreak. We coded roughly 4,500 news articles, and we used mTurk to categorize these as containing a gist or not, containing statistics or not, and other covariates. And long story short, what we found was that gist was the primary driver of whether something was shared at least once. Statistics also had an impact. So this notion that statistics don't matter is not true, but controlling for statistics and gist, stories don't actually have a significant effect. And then when we look at what made things go from more than one share, or rather one share to more than one shares, only gist predicted significant numbers of shares. So that sort of supports fuzzy trace theory's predictions. And we replicated this on Twitter data, where for purposes of time, unfortunately, I don't have a lot of time to go into it. But long story short, tweets that communicated a causal link between vaccines and autism were much more likely to be retweeted rather than tweets that talked about vaccines and autism but didn't use that causal language. And in fact, when we have tweets over here that talk about vaccines and autism, but then start providing a lot of verbatim information, they were actually less likely to be shared, also supporting fuzzy trace theory's predictions. So the implications here are that causal gist seems to be associated with the efficacy of these online messages. The notion that facts don't matter is simply not accurate. But the effect size is small. And so this speaks to the need to contextualize those facts and the fact that health communicators can actually have a positive impact by taking evidence-based facts, but then appropriately contextualizing them and communicating them in a categorical bottom line meaning. Conclusions here that I want to emphasize are that the social media landscape combines a very wide range of account holders. There are, of course, state-sponsored, large bot campaigns. There are also sincere, true believers. And these have a wide range of hidden agendas going from, as I mentioned before, state-sponsored trolling to genuine believers, people marketing alternative products, simply people that might want you to click on a link so that they can infect you with malware or spam you. And as public health communicators, one of the things we have to think about is how do we adapt to this changing landscape? And so I would point to the fact that there are several leading theories out there that make specific predictions and have promising areas for future research. And we can directly test several of these through a combination of experimental and observational interventions. So with that, I'd like to open the floor to questions.
Great. Thank you all so much. This has really been a fantastic conversation. I'm so appreciative of everyone joining. I had a couple of conversations or questions rather, that I wanted to run by you, and then would turn it over to the Q&A. Both Kathleen and Jake, your presentations spoke to what I seemed to understand to be a pretty small number of novel narratives, looking at both of your numbers, and then also Jacob at the Oxford Internet Institute study from yesterday that you referenced. Is it correct to understand that it's really only something in the vicinity of 250 to 300 novel narratives that we're seeing, and everything is sort of spins on those, or did I misunderstand your numbers?
I mean, so I can speak from our perspective. That's right so far, but that's heavily biased towards English language content, which is where we started. We've only recently started getting into the other major languages around the world in terms of Hindi, Urdu, Indonesian, kind of the major European languages, and obviously Chinese. And so I would expect that number will be significantly larger once folks have spent as much time on those other languages as they have on English. But I do think it's correct that in English, the number of narratives is not huge. Mm-hmm. And I think, and Kathleen, I think could speak to this much better than I can. Her evidence suggests that The volume of sharing is substantial, however. And so there's a lot of churn on the same topics.
Yeah. That makes me somewhat cautiously optimistic that this might be a more tractable challenge if you have a confined set of narratives, which makes me surprised to see. I think you had said that the rate of retention of these narratives was close to 60%, which is a little disappointing. Kathleen, anything you would add?
So I would put this in the context. So with other natural disasters, the number of disinformation campaigns that we often see are usually under 50. And so the fact that in this one we're seeing close to at least 300, you know, that's a huge difference. That's a huge jump. Okay, so I don't think it's that few. That's part of the context thing. The other thing is it is getting extremely widely spread, and at least for the conspiracy theories, we're seeing those in every language.
Mm-hmm. And do we have a sense of the volume here and the rate of exposure? I know that, you know, Jake, you had mentioned David Lazar's study that was, you know, that you had a pretty concentrated group of people that were, I think it was like 1%, and it tended to be people that, you know, were consuming 80% of the content. They were older, Caucasian males for the most part. Do we know anything yet about the concentration of exposure, or is it much more widespread?
I am not aware of anything really great on that yet. It's something certainly Kathleen and I have had some discussions on, but I'm not aware of anything that's that I would call it high reliability on that yet.
Mm-hmm. And Kathleen, oh, sorry.
I just said I'd agree.
And Kathleen, you had mentioned also a pretty high rebroadcasting rate here of disinformation relative to accurate information. And I know we've seen the same thing in political content, with some studies suggesting that the share rate of inaccurate information is something like 6 times higher. I think the hypothesis is that when you can completely make things up, the novelty of what you're sharing tends to be much higher than when you are constrained by facts. And so people are more inclined to share inaccurate information just because it tends to be a little bit more interesting and novel. Do we know anything about the rate of share of inaccurate information related to COVID yet, or that we're seeing similar patterns?
Yes, it is much more likely to be shared. It's not 6 times, but it is much more likely to be shared. It's slower, it's smaller. But the other thing is that's the resharing of things that are factually incorrect, okay? But there's a whole other kind of thing that's going on with COVID, which is that adversarial actors are actually using influence campaigns where it's not necessarily factually incorrect, but it's misleading or it's meant to create mass hysteria. And that is being shared even more than the factually incorrect information.
Really interesting. And then a question that had come up in the chat box, and I think it's relevant to a lot of trends that we're seeing in political disinformation right now, which is this question of attribution. And I think early on, back in 2016, we saw many of the social media platforms' primary strategies focused on understanding or trying to understand who the actor was behind content and taking it down, you know, that way. When people were paying in rubles and using quite poor English. Now we're seeing, at least on the political side, really newer, different approaches to sharing disinformation, you know, copy pasting text to avoid grammatical errors, using screenshots, which can, you know, make it harder to, and I remember, Jacob, we had you were on the fake news site email chain recently talking about, you know, how our detection techniques need to evolve now that people are using more screenshots. And then one of the questions in the chat box sort of touches on this theme of paying locals to post stories, which I think we've been seeing in Africa, where you have Russians and others paying legitimate local actors to post. So again, running into these sort of attributional challenges. What are you guys observing now that I think might have implications for the 2020 elections and beyond, in terms of how techniques for distributing disinformation are evolving?
So I think I can speak to that briefly, I do think it's getting more difficult, obviously, to algorithmically identify actors that are engaged in these sorts of malicious behaviors. But at the end of the day, it is a certain sort of tactic or outcome that they're trying to elicit. And so if we have techniques that can focus on measuring those outcomes, for example, is there a generic shift towards changing the way in which people in a corpus, rather than specific tweets, perceive a specific actor or a specific state, then that's something that allows us to get a lot more traction and then further refine what we might look into as we move forward. So for example, in our work looking at the association of Russia with calm and China with panic, that doesn't necessarily rely on saying that there is one particular account or set of accounts that are engaged in a coordinated campaign, but it still does allow us to get a sense that there is, shall we say, an unexpected association.
Thank you.
I think that there's a meta point here, which I think is important to keep in mind, which is the more the disinformation actors need to make their content look like normal content, the harder it is for them to achieve scalable effect. And if you think about each piece of content as something that moves someone a little bit and it will move them further, the farther it is from the normal conversation, then they either need to produce a lot of volume or highly novel content. And both of those things yield detectable traces. And so, it's the fact that it is becoming harder to pick it out likely means that on like a per person hour dedicated to the effort on their end, it's going to be less efficacious. It's basically like taxing the activity.
And I should interrupt real quickly to say we were going to try and go ahead and for 15 minutes until 11:15, given that we got started a bit late, if that's okay with others. And if anyone needs to drop off, just let me know. But Kathleen, did you want to jump in on that?
Yeah, so I want to say what we're already seeing is an increased utilization of memes and videos as a way of spreading the disinformation. And while videos are often taken down by YouTube fairly rapidly, that is not the case for memes. So memes is definitely going, it was used in the 2018 elections very effectively, but we're seeing an explosion of that. I would expect to see that also in the 2020. The other thing that we're seeing are these armies of bots around candidates that are just, they don't even know they're there necessarily, and they're re-spreading out, not just what they say, but they're redirecting and rebuilding communities around certain candidates of people who wouldn't normally pay attention to that candidate. So they're actually using the way they post on social media to build social networks, social connections.
Really interesting. And, these changes in behaviors that we're observing sort of lead me to come back to this question of sort of platform responses and to the beginning of the conversation and about, how effective are Twitter and YouTube and Facebook appearing to be in taking down this content. I know there have been a lot of movements by the platforms here. I think it was last week, Facebook, Google, LinkedIn, Microsoft, Reddit, Twitter, and YouTube released a joint industry statement noting that they are working closely together on these efforts. They are combating fraud and misinformation about the virus jointly by sort of elevating authoritative content, coordinating better with government and healthcare agencies around the world. They've invited other companies to join them. All of them appear to be relying much more heavily on automated tools rather than human moderators, in part because companies like Facebook have noted that they've had to shift resources more towards monitoring suicide and self-harm and away from some of the other content they might have been moderating. They're certainly getting more aggressive. I think we saw Facebook taking down the Brazilian president's live stream last week for spreading misinformation. We saw Twitter temporarily block Rudolph Giuliani's account for spreading misinformation. And yet there still seems to be a fair amount of it out there. Would be really curious to hear what your perspectives are on how the platforms are responding, and this sort of relates to a question that came up in the chat Q&A as well. What could different actors be doing differently here? Next week we're going to have, or rather the next session, which will be on April 22nd, we'll have a webinar that's focused on journalists and how they are covering sort of disinformation in the digital age, everything from COVID to the elections. But curious what you guys think about how the platforms are responding, what more could be done.
Well, one of the things I would say is that I think the banding together and everything is having an effect. And in fact, one of the ways we often are able to track things down is because of what they've removed. So I think that is useful, but then we have to go to other sites. I think more coordination among more of the platforms would be valuable, and also links out to the news agencies and coordinating more with the fact-checking sites and so on would also be valuable. Most of them do have ways you can report things, so that the everyday any citizen can report things, and that becomes helpful as well. But now that's led to another problem, which they're needing to find people to vet those reporting, so it doesn't become just, oh, I didn't like Joe, so I'm reporting on him kind of thing. Yeah. And the other thing I want to add is that going to the AI techniques in this area is a two-edged sword, because they don't necessarily work well in the wild, and they sometimes backfire. And that's why you saw things like them taking down New York Times and other things when they didn't really mean to. And so it makes it harder for actually journalists to operate and to tell stories about things like disinformation, because they can get caught by these kind of things. So it's a two-edged sword.
So the other thing that I would emphasize in addition to that is that the platforms really have different technological implementations. And so a strategy that works well for Facebook may not necessarily work well for Twitter, which may not work well for Reddit. And I think that at the level of the sort of inter-platform, coordination, there's a lot of work to be done on agreeing on general principles for what constitutes abusive behavior. And I think that the question of how then do you go about implementing technological solutions is really much more platform specific. So for example, Facebook has administrators and groups, and maybe there might be a reason to consider holding certain administrators responsible for some of the content in their groups, whereas on Twitter, that construct simply doesn't exist. And so there may be different approaches that make more sense on Twitter that maybe, for example, would focus on trying to downgrade clearly automated accounts, for example. So I think that we can't do this independent of the technology.
Yeah, I think, Kelly, I think there's an important question which follows from the idea that more coordination is valuable, which I think we'd all agree to, which is what are the institutions that you build to make that happen in an enduring way that's robust to the frequent internal reorganizations which happen at all of the companies, right? So these are all extremely dynamic organizations. Things change multiple times within a given year. And so it's hard to construct those relationships between companies when the stakeholders within each are constantly turning over. And we as a society haven't yet figured out, like, what are those institutions which can make that cross-company coordination durable, sustainable, and enduring, so that when something like this comes down, we're not scrambling around these kinds of conversations. There's something which has the expertise and the knowledge to do the work that already exists.
I think this is a really great and important point, and there are obviously efforts like the Partnership on AI that that have helped companies coordinate better. And we have in my prior life in philanthropy spent a lot of time looking at what are the equivalent kinds of institutional structures that we might need in this sort of information quality space to help coordinate here, that because yes, there are quite significant turnover rates. And then also, where do you draw the lines in terms of how large these different platforms are that you engage? Because while there is relatively strong information sharing between the larger platforms, when you get into some of the smaller, Gab AI, 4chans, 8chans, not as much. So other thoughts on things that platforms could be doing better? Or there was a question, well, I'll pause there for a second and then move to another question on how to find disinformation.
Since you mentioned Gab and the chans, I do think that there is something that that we should think about, which is there are platforms that have exhibited more social responsibility than others. And I think that there is an opportunity for those socially responsible platforms to generate a consensus statement or set of policies regarding what constitutes socially responsible online behavior. And then I think that having generated such a consensus statement and agreeing, and then having agreed to uphold it, that actually sets the gears in motion for possible responses that other platforms that don't necessarily agree to hold by those standards might then be evaluated by. And whether that's on one extreme a legal response, and on the other extreme simply one involving certain kinds of incentives, is obviously to be determined by policymakers. But I think that the larger, more socially responsible platforms need to show leadership here, because the alternative is that their lack of action allows these other platforms freedom to do whatever they want to do.
David, this is a great point, and has the added benefit of allowing me to segue well into another question from the chat. But there is a great effort underway that has been in progress for almost a couple years now between Eli Pariser, who wrote Filter Bubble and started MoveOn.org, and then Upworthy, and Talia Stroud, who runs the Center for Media Engagement at the University of Texas, that is looking at, how do we define good? And one of the questions, good information, a healthy information ecosystem. And a question from the box came up of, how do we determine what is disinformation versus accurate, which is, a terrible but great question to try and end a panel on, because there's nothing near a consensus about this in the field. But so I would flag that Talia and Eli have been working on that point of how do we define a healthy information ecosystem, and what are some of the metrics that we could lay out for trying to hold platforms accountable to that, either legally or just culturally. What does good look like? And then I'd love to hear from each of the panelists how you think about disinformation versus accurate information. The one thing I will say in advance is I've appreciated the real movement in the field over the last 4 or 5 years away from content-based decisions towards behavioral-based or actor-based decisions. This sort of ABC framework that I think Camille Francois at Graphica has put out around not just looking at content, which can be really hard to determine the veracity of at scale, at the speed we're talking about, Jacob, to your point, in the foreign languages that we are wrestling with, but instead looking at, when are we observing coordinated manipulation campaigns? And so I'm curious, and this was from the Q&A, how you think about defining, are you using content-based or actor-based or behavior-based approaches, or both? Kathleen, do you want to go first since you're unmuted?
Sure. So when we write about disinformation, we define it as intentional spread of facts that are inaccurate, and misinformation as unintentional spread of things that you think are facts but are inaccurate. But and the way we would find disinformation in things is a combination of behavior and content. So we would notice an anomaly in behavior, we would see what they were talking about, and then we would check out the content. Because if you just do behavioral, you can also get things that are not technically disinformation and find out. That being said, the vast majority of our work is actually on influence campaigns, more broadly defined. And so we actually look at when is it propaganda versus when is it just normal, salesmanship versus other kinds of activities.
Thank you, Kathleen. And do you guys have anything different to add to that, or we have 2 minutes left if there are any other sort of closing thoughts or big picture comments you'd want to leave folks with?
So I think that I'm just going to once again mention this constructive gist, because I think it's really relevant here, where the notion, I think we can sometimes get a little bit too wrapped up with the concept of what is factually accurate, because so many disinformation campaigns and misinformation items are simply facts out of place. They are decontextualized facts. They are inappropriately contextualized facts. Many foreign adversaries report on things that are factually correct and nevertheless amplify them or put them in contexts that make one draw incorrect conclusions, or simply boost a narrative that the U.S., for example, is not trustworthy. And so I think, I didn't put this in one of my slides, we were looking through a set of 10,000 tweets pertaining to coronavirus. I think we found something like 600 of them contained verifiable factual inaccuracies. So a very small proportion. And so this notion of gist, I think, is important because it really emphasizes what is the bottom line meaning to the audience. Now, of course, that is significantly harder to automate. That requires an interplay between the social sciences and computer science in a way that that is not as algorithmic. But I think at the end of the day, it really gets to the essence of what these disinformation campaigns are trying to do.
Thanks, David. Jacob, any last thoughts?
I would just say that for folks interested in working on this, the kind of network and breadth of the fact-checking networks that have arisen and the extent to which they have accessible, easy to hit APIs or nice agglomerations of their data online is like really remarkable. And so if someone wanted to pull facts from multiple countries or fact-checking on this topic from multiple countries, you know, it's like an afternoon worth of work. And then you can do all kinds of things like with that. And that's a really fantastic development and very different than the nature of affairs even 2 years ago.
Yeah, it was really wonderful to see the resource list you shared earlier. And to that point, if any of you are willing or able to share slides, I think some of those could be quite helpful. And if you send those along, I'd be happy to post them if you're interested. And with that, I will end us and just say thank you all so much. This has been really an even more engaging conversation than I had hoped for. This is really, really helpful. And next time we all meet on April 22nd, we will have Andy Grotto from the Stanford Cyber Policy Center and Janine Zakaria from the Communications Department, along with Joan Donovan from Harvard Shorenstein, talking about how to improve journalistic coverage of the 2020 elections, of the coronavirus, and beyond, everything from how journalists should cover hacked news to the role that bots are playing in a lot of this. So we'll look forward to that. But until then, thank you all so much and stay well.